Hello health champions! Wim Hof, also known as the Iceman, is known for a certain breathing technique and also for being able to withstand extreme cold. They've done some studies that suggest there's some health benefits to the Wim Hof method, but I haven't found anywhere where they talk about how these benefits would come about. So today I'm going to talk about the mechanism and what really happens in the body when you do that type of breathing and when you do ice baths, so that when you understand the mechanism, then you can adapt the method to fit your lifestyle and you can get all or most of the benefits without having to become an Iceman. Unless, of course, that's your idea of fun. Coming right up. Hey, I'm Dr. Ekberg. I'm a holistic doctor and a former Olympic decathlete. And if you want to truly master health by understanding how the body really works, make sure you subscribe, hit that bell, and turn on all the notifications so you never miss a life-saving video. The Wim Hof method, according to the founder, involves three things: breathing, cold therapy, and mind focus. The Wim Hof breathing starts out with 30 power breaths, and this is where you breathe in as much as you can and then you blow it all out as much as you can, and you keep doing this rather forcefully. You go very powerfully on purpose. And what might happen is you get dizzy and or lightheaded, and you might even pass out. So it's a good idea to lay down or be in a recliner where you're not going to fall anywhere if you actually pass out. Then when you've done these 30 power breaths, now you blow all the air out. You exhale and hold. And you do that for as long as you can, and when you can't hold your breath anymore, you take a deep breath in and then you hold it. And when you are done with that, now you exhale and hold, and you repeat this up to 10 times. To understand anything about the Wim Hof method, we need to understand the autonomic nervous system, because Wim Hof has been known to control his autonomic nervous system by will. And this is the part of the nervous system that controls the things you don't have to think about normally. So blood pressure and digestion and muscle tone and so forth, they are at a certain level automatically. These functions are managed for you. And they have two branches, your sympathetic and your parasympathetic nervous system. And this is kind of like a seesaw. Whenever one goes up, the other side goes down. Same as when you're driving a car, you can't speed up and slow down at the same time. You have to pick one. And this is hardwired into your nervous system that they're going to alternate. This is your resource allocation system. And the sympathetic is going to allocate resources to defend you. This is called the fight-flight system. And it's your alarm system. If you're standing in the street and a car comes rushing up, or if you're in the woods somewhere and a bear comes running up, you're in an alarm state. Your body is going to mobilize resources. It's going to increase heart rate. It's going to increase blood pressure to pump more blood. It's going to increase muscle tone to get you ready to get out of there as quickly as possible. It's also going to increase stress hormones like adrenaline and cortisol to raise blood sugar and mobilize energy. And everything about the sympathetic nervous system is about focusing outwards. That if there's a threat out there, you have to defend yourself against that threat first so you can survive before anything on the inside makes sense. An interesting thing to know is that anytime that you breathe in, your heart speeds up. And the only time the heart speeds up is when there is sympathetic activation. Therefore, your breathing is tied to the balance of your sympathetic and your parasympathetic nervous system. So we're going to talk about how this fits in with the different breathing patterns. And the parasympathetic obviously is the opposite. It's known as the feed, breathe, or rest, digest system. It does the opposite. It lowers blood pressure, lowers heart rate, lowers stress hormones. And it's involved with inside functions like digestion and immune system and reproduction and sex. Now, of course, this is about directing resources inwards. So you can pretty much, if you understand how this balance works, then you can allocate resources inside to heal, or you can allocate resources outside against the outside to defend yourself, but you can't do more of both at the same time. The seesaw principle is going to make the nervous system pick one or the other. And of course, when you breathe out, now your heart rate is going to go down. And this makes a lot of sense because the body is smart. When you breathe in, there's more air in the lungs, more oxygen to be absorbed, and therefore it makes sense to speed up the heart and send more blood there to pick up the oxygen when there's more of it there. And then when we breathe out, we don't want to waste our energy, waste our resources, so the heart slows down. And this is called heart rate variability. I've talked about breathing in the past, and after that people always ask me, well, which kind of breathing is the best? Because I've heard about different kinds of breathing that are different than yours. So it's not that one is bad and another one is good, it's that they're different. And once we understand what's happening with this breathing mechanism, now we can kind of understand when and how to do it. So the breath I usually propose is an even 5 seconds in and 5 seconds out. Maybe a little bit longer on the out breath. And here's why. Most people breathe in for 2-3 seconds and then breathe out really fast. And they breathe in for 2-3 seconds and out really fast. So with the in-breath, they're activating their sympathetic nervous system, but they're breathing too fast to allow that parasympathetic nervous system to kick in and balance out the sympathetics. So most people get stuck in that state of stress and anxiety. And of course, then the anxiety makes you breathe even faster, so you're sort of stuck in a vicious cycle there. But if you allow 5 or 6 seconds to breathe out, you're allowing the parasympathetic to kick in and balance the sympathetic. That's the purpose of this particular breath, to balance your autonomic nervous system and bring you in a state of relaxation. 2 things happen when you breathe. First, you take oxygen in, and also you take carbon dioxide out. And the thing about carbon dioxide is that it's acidic. So this is a way that the body can regulate pH of the blood. If you don't breathe enough, then the carbon dioxide builds up and your blood gets acidic. And this is actually the trigger for your body to breathe more. There's a sensor in your brainstem that says the blood is too acidic, breathe more. And this is a much stronger influence actually than the oxygen need. Now, when you breathe in balance like this, the purpose is to create balance, also known as homeostasis. When they measure heart rate variability, when they measure the pattern of how the heart rate increases and decreases with the breath, when you get into a perfect, smooth, and rhythmic pattern, it's called coherence. And that's a very healthy place to be. That means that your brain and your heart are working together. They're cooperating in harmony. This kind of breathing is also very relaxing, obviously. And when you do it and you stay within these relaxed physiological parameters, then the body is going to regulate the pH and the CO2 and the O2 and put them all within optimal levels. Then what about the Wim Hof breathing? Well, it is not a relaxed breath. You breathe in as much as you can and out as much as you can, and repeat 30 times, and oftentimes you get dizzy or even faint. So this is a forced breathing. It's unbalanced, it is stressful, it's unnatural, and what happens now is because you're forcing the breathing, you're blowing off way more carbon dioxide than your body calls for. So you're artificially bringing your pH up. You're making your blood alkaline, and this is why you get dizzy and lightheaded. At the same time, your CO2 levels go down, and your oxygen levels go up. Then once you're done with the 30 breaths and you blow out and you hold, now your body is really alkaline. Your blood is really alkaline. And because it's the CO2, the acid CO2, that makes you want to breathe, that gives you that air hunger, you're not going to have any air hunger when your blood is alkaline. So it's very easy to hold your breath. It might be 30, 40 seconds before you have any urge to breathe, and you might be able to hold this for quite some time. And then, of course, you alternate breathing in and breathing out. But whenever you're holding your breath, you are increasing growth hormone. They've done studies on this. They're taking people, just have them hold their breath for as long as they can, repeat a few times, and their growth hormone levels increase. And now, cold therapy. This is something that you can practice from the discomfort of your own home. I added the discomfort part because I don't know about you, it may or may not be your idea of comfort. However, it is an extreme stress. It is an increase, it's a powerful, massive increase in sympathetic drive. It causes vasoconstriction and it has your blood pressure shoot through the roof. You could probably, if you manage to measure it right in that moment, it would probably be 200, 250, something like that. Anytime you shock your body or stress it significantly, the body is also going to make growth hormones so that it can adapt. Now that we understand a little bit about the breathing and the cold therapy, what really happens in the body, the next question is this actually a good thing? Well, we have to start understanding a little bit more of what stress is and what it does and the different types. So short-term physical stress is very, very normal. This is when you have to get out of the way from a car. This is where you respond to something physical, you defend yourself, you do a workout, you have a physical strain of some sort. And now it's adaptive. That type of stress is adaptive. It gives your body a chance to adapt and get better for when it's going to happen next time. Therefore, it's very healthy and it's very constructive. It gives the body a reason to improve. So now if we understand these parts, then we also see that it's necessary. Because if you don't have these, if you don't have this short-term physical stress, then you're not giving your body a reason to adapt. You're not giving it a reason to get better. And in one word, that's called degeneration. But the other kind of stress is destructive. That's the chronic stress. We're designed for short-term physical stress, but chronic stress is the stuff that we can't bounce back from because it just goes on and on. And a lot of this stress is emotional. And if we have anger or anxiety or depression or worry or fear, then these are emotional habit patterns that break us down. We can also have excess physical stress. And even though exercise is necessary and hugely beneficial, if we do too much, then it breaks us down. Exercise is breakdown, and when we recover, when we rest, we allow the body to build back up. But if we work out too much, or we don't allow enough time to the next workout, now we're just adding insult to injury and we break the body down more and more. So this chronic stress we're not designed for. It's abnormal, it's maladaptive, it's unhealthy, destructive, and in the case of emotional stress, these are habitual patterns that we create. And just like you can create a skill of any kind, you can create a language skill or the skill of catching a ball, these are neurological patterns. And they work for you, but they also work against you in the case of negative emotions like anger and fear. Wim Hof talks a lot about the mind also, and that's an important aspect. And it takes a certain amount of dedication, of commitment, of determination to jump into that ice water. So you have to sort of focus your mind first. You have to make a commitment. And then once you jump in, this is a massive sensory input. You're firing off all types of receptors and pathways and hormonal responses. So massive sensory input, it's a type of shock. And when you do that in an extreme form, you increase your focus, right? You're going to jump into that ice water and you're not going to think back and say, I wonder if I remember to feed the dog before I left, or worry about what I'm going to do later on today. You're not going to do that. You're going to be right here, right now. You're going to be present in the moment. You're going to be focused on what's going on because you're in the ice water. And that improves your focus, which is a good thing. It involves frontal lobe activation. And the frontal lobe, it's like a muscle. You work out muscles with weights, you work out the frontal lobe with signal stimulation, and then once the frontal lobe is activated and strengthened, it actually gets better at inhibit that sympathetic nervous system and the stress response. One way of thinking about it is also like a rubber band. That if you really want to relax a muscle, it can help to contract it first and then notice and accentuate the contrast. This sort of works the same way. You jump in the ice water and you really fire off that sympathetics, but then that makes it easier to notice the contrast and relax, so you kind of get a rebound parasympathetic response. So there's several benefits. You have a pattern interrupt, and this is very, very powerful, that most of our health problems, most of our emotional problems is because we get our pathways, we get our nervous system stuck in certain pathways, in certain patterns. And one of the most powerful things you can do is to interrupt that pattern. Make the nervous system just do something else. Anything else at all is good. And you also get hormonal bursts. You activate survival circuits. You have sirtuins. You have survival genes. And if you expose your body to something harsh, then the purpose of these survival genes is to help you through that crisis, that harsh period. So in the short term, you make adrenaline, which is a stress hormone, but as soon as you get out of the water, that adrenaline is going to go down very quickly, but instead you have a long-acting benefit from the human growth hormone that decays, that have a much slower half-life. You also get the brain stimulation, which is like a workout for your brain, and it helps you get even more calm after. So here are a lot of clear benefits of doing this method. So now that you understand the benefits, now I'm sure you're wondering, well, do I have to do all of that? And how much do I have to do? Do I have to become an Iceman to get these benefits? Well, let's talk about it. If it thrills you, then I think you should be an Iceman. If you really get a kick out of walking on coals and jumping out of airplanes and sitting in ice water, and you can look back and feel good about the fact that you did that, then that's an added benefit. So if that's your personality, then go for it. The only thing I want to point out is about your particular health state and the duration. Because when it comes to the ice bath, for example, they talk about starting off with 30 to 60 seconds and maybe working up to 15 minutes. As humans, we tend to think that if a little bit is good, then more has to be better. But that's not really how it works, as we saw with our discussion on stress before. That our bodies are designed for short stress. That's what creates the trigger. The body gets the point and then it makes the changes. So I'm not convinced that 15 minutes is better than 60 seconds. Okay, this is my opinion. I don't know that anyone has really studied this, but the other part is that if you're not super healthy, if you have a weak heart, weak adrenals, you could get in a lot of trouble. You could actually trigger a heart attack. If you have a weak heart and you jump into ice water, it's like you lock down all of your blood vessels, and it's like the heart is trying to pump against concrete. And a healthy heart can handle that, a weak heart might not. Same thing with adrenals, that a little bit might be good, might be just like a little stimulation, but if it goes on and on and on, now you might actually sort of whip those adrenals beyond the point of health. So if you like doing this and you're healthy, I would say go for it. There's certainly benefits. Now, what about the softies? What if we're not looking forward to the next time we plunge into the ice water? Then we have other alternatives that, in my opinion, can probably create most, if not all, the benefits. Fasting is the single most powerful way to create growth hormone. And the longer you fast, the more growth hormone you make. I've done several videos on that. Fasting alone is not going to get you fit. It's not going to stimulate your brain tremendously, even though it has benefits. So you always want to do more than one thing. And high-intensity interval training is an excellent way to stimulate your brain, to create more growth hormone, to challenge these survival circuits and these adaptive circuits. So Wim Hof breathing is an excellent idea. I think it's a good addition, but again, understand why you're doing it, that it's stressful. And again, I don't think that more is better, but I would use it as an introduction, as a warm-up to a relaxing breath. So you do the power breaths with the Wim Hof, you can do some breath holding if you like, but then you sit down and you relax, because now you've stirred things up. You're in a very receptive state for your body to relax, and now you do that 5 seconds in and 5 seconds out, and you allow your nervous system to get back into homeostasis and create some long-term neuroplasticity. When it comes to cold therapy, it turns out that both hot and cold will produce growth hormone, it will stimulate your autonomic nervous system, it will shake things up. So if you don't like the ice baths, you could just alternate warm and cold showers. So you do your shower, and then at the end of it you turn up the heat a little bit, and then you turn on the cold, and you just do that back and forth a little bit, and you have created a lot of the same effects. Now, the Scandinavians, the Finns and Swedes, have known this for centuries. They have something called a sauna. And this is a very hot place. You throw on some logs on the fire and you create tons of heat and steam. And you sit there and roast. And that hot in itself is quite effective. But then if you go outside and you jump in ice water or in a cold shower, now you accentuate the effect of the contrast. And here's the interesting thing. For those who have the facilities, the availability to do this, I strongly suggest to do a sauna and then jump into really cold water or ice water. And you'll be amazed because it's not going to feel cold. When you're really, really hot and you create that contrast, for the first 5 to 10 seconds, your body doesn't know what happened. It does not feel cold. 10 seconds into it, you start feeling cold, but it's not really unpleasant because you were so hot. So you don't have to freeze to get the benefits. You just have to create the contrast. And then you jump out of the ice water and you stand there after a minute and it feels really nice and warm. You're steaming off of your skin. You look like a red lobster, but you're feeling so peaceful and so wonderful. So if you have a chance, give it a try. If not, just work with it in the shower. If you enjoyed this video and you like learning about how the body works and how to get really healthy, I would suggest you watch that one next. Thank you so much for watching. I'll see you next time.